Hello and welcome, dear viewers. Welcome to our channel. Today, we're going to talk about a very important health topic, measles. Did you know that this seemingly simple illness can actually be very dangerous and highly contagious? Early detection and prevention can protect the health of our children and loved ones. So stay with me until the end of the video. I'll explain in simple terms the causes, symptoms, treatment, and most importantly, how to prevent measles. Measles, what is it? Measles is a highly contagious viral disease that mostly affects children and unvaccinated individuals. It is caused by the measles virus, which spreads through the air coughing, sneezing, or talking. How is it transmitted? The measles virus spreads through airborne droplets. When an infected person coughs or sneezes, the virus is released into the air. It can also spread through contact with contaminated surfaces, then touching the eyes, mouth, or nose after entering the body. Symptoms usually appear within 10 to 14 days incubation period. Main symptoms. 1. Early symptoms 1 4 days. High fever 38 minus 40.5 degrees Celsius. 100.4 minus 104.9 degrees Fahrenheit. Runny nose, sneezing, cough, red watery eyes, conjunctivitis, fatigue, headache, complex spots inside the mouth, small white spots. 2. Skin rash after 4 to 5 days. Starts on the face and spreads to the entire body. Red, small spots that may merge together. Fades after 5 to 6 days. Possible complications. While measles can be mild in some cases, it may lead to serious complications, especially in vulnerable individuals. Otitis, ear infection, bronchitis or pneumonia, lung inflammation, encephalitis, brain inflammation, rare but dangerous, vision problems or blindness, growth and developmental delays in children. Prevention, most important step. The most effective way, vaccination. MMR vaccine protects against measles, mumps, and rubella. Given into doses at 12 months and 6 years of age, varies by country. Very effective. Provides 97% protection. Treatment. There is no specific antiviral treatment for measles, but symptoms can be managed and complications prevented. Rest and plenty of fluids. Fever-reducing medications like paracetamol. Keep eyes and nose clean. Antibiotics only if secondary bacterial infections occur like pneumonia. Who is most at risk? Children under 5 years old. Unvaccinated adults over 20. Pregnant women. People with weakened immune systems, for example, cancer or HIV patients. Interesting facts. Measles still causes thousands of child deaths worldwide each year. In many countries, vaccination programs have nearly eliminated the disease. It's extremely contagious. One infected person can spread it to 90% of people nearby if they are not immune. How does measles develop? Measles is a viral disease caused by the measles virus. The disease typically develops in the following stages. 1. How does the virus enter the body? The measles virus spreads through airborne droplets. When an infected person coughs, sneezes, or talks, the virus is released into the air. A healthy person can breathe in the contaminated air or touch a surface with the virus and then touch their mouth, nose, or eyes, allowing the virus to enter the body. 2. Incubation period, hidden stage. After entering the body, the virus remains hidden for about 10 to 14 days without causing any symptoms. During this time, it multiplies inside the body and gradually begins to show signs. 3. Beginning of illness. The virus first affects the respiratory system. Then it spreads through the bloodstream to the entire body. The immune system reacts and tries to fight back, leading to symptoms such as fever, cough, runny nose, red, watery eyes. 4. Skin rash. As the virus spreads and affects the body more strongly, a red skin rash appears. The rash usually starts on the face and then spreads down to the rest of the body. Conclusion. Measles is caused by a contagious virus. It spreads through the air, enters the body, multiplies silently, and then affects the respiratory system, skin, and the entire immune system. Is measles related to climate? Measles is a viral infectious disease, and while it is not directly caused by climate, certain climatic conditions can influence how often and how quickly it spreads. 1. Cold seasons, winter and early spring. Measles is more common during colder seasons because people tend to stay indoors in schools, homes, daycare centers. This makes it easier for the virus to spread through the air. During winter, the dry air can weaken the respiratory system's defenses, making people more vulnerable to the virus. 2. Hot and humid climates. In warm and humid conditions, the measles virus does not survive long outside the body. As a result, measles is less likely to spread in hot climates. However, if people are unvaccinated, the virus can still spread, even in warmer regions. Conclusion: measles is not caused by climate, but cold and dry seasons increase the risk of outbreaks because people spend more time indoors and the air weakens the body's defenses. Psychological impacts and complications after measles. While measles is primarily known as a viral infection, in some cases it can lead to serious neurological and psychological complications, especially if the illness was severe or involved other health issues. 1. Encephalitis, brain inflammation. One of the most dangerous complications of measles may occur 1 to 2 weeks after the initial illness. The virus affects the brain, leading to mental, emotional, and motor disturbances. Symptoms may include severe headache, vomiting, confusion or altered consciousness, slow memory or speech, irritability or extreme apathy, seizures, convulsions. Encephalitis can cause long-term neurological damage, especially in young children. 2. SSP, subacute sclerosing panencephalitis. Rare but extremely serious. A chronic brain condition that may develop years after a measles infection, usually 5 to 10 years later. Most common in children who had measles at an early age and were not fully immunized. Symptoms: progressive memory loss, personality changes, loss of motor coordination. In late stages, coma and even death. 3. Emotional and psychological stress, especially in children. During and after the illness, children may experience long periods of bed rest and isolation, fear, confusion due to high fever or strange symptoms like rash or eye discomfort. After recovery, anxiety or sadness, lack of interest in school or play, difficulty concentrating or fatigue. Emotional trauma from illness may affect a child's development and social behavior, especially if support is lacking. Medical advice: monitor your child's emotional and behavioral health after recovery. Seek help from a psychologist or neurologist if you notice mood changes, learning difficulties, motor or speech problems. Encourage gentle reintegration, talking with the child, drawing or playing, slowly returning to school or social settings. Summary: measles can lead to serious mental and neurological complications, even after recovery. Psychological support and medical monitoring are important to ensure full emotional and cognitive healing, especially in children. How to prevent measles and maintain a healthy lifestyle after recovery. 1. How to prevent measles. Vaccination is the most effective protection. The MMR vaccine, measles, mumps, rubella is given in 2 doses at 12 months and again around 6 years of age. It provides up to 97% protection against measles. Unvaccinated individuals are at high risk of infection and can also spread the virus to others. Personal hygiene and safety measures. Avoid close contact with infected people. Practice good hand and face hygiene. Use masks in crowded or closed spaces, especially during outbreaks. Be alert to flu-like symptoms during epidemic seasons. 2. Healthy lifestyle after measles recovery. After recovering from measles, the body is often weakened. A healthy lifestyle is essential to rebuild the immune system and regain strength. Rest and sleep. Ensure enough sleep 9 to 10 hours for children. Avoid physical and mental overexertion. Emotional well-being. Let children play, talk, and express their feelings freely. Provide emotional support, love, and reassurance. 3. Proper nutrition for recovery. The body needs nutrient-rich foods to restore strength and support the immune system after illness. Recommended foods. Fruits and vegetables rich in vitamins and C. Oranges, carrots, spinach, apples. Protein sources like eggs, lean meat, fish, and legumes. Dairy products for calcium and protein milk. Yogurt, cheese. Whole grains like brown rice, oats, and buckwheat. Plenty of fluids, water, herbal teas, natural juices. Avoid fried and oily foods, sugary snacks and sodas, excessively salty or spicy meals. Summary: the best way to prevent measles is through vaccination and good hygiene. After recovery, focus on healthy food, enough rest, hydration, and emotional care to help the body and mind fully heal. Your health is your greatest wealth. Taking care of yourself today leads to a healthier, happier tomorrow. If you found this video helpful, give it a like and leave a comment below. Don't forget to subscribe to the channel for more trusted and easy to understand health content. You are a valuable part of this community. Stay safe, stay healthy, and take care of yourself. Health is your power. Protect your health, protect your future. Small steps today, big results tomorrow. Subscribe now, let's grow stronger together.